It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to this week's episode of Morton in the Morning. I'm your host, Julie, and we are coming to you live from Morton Hospital right here in Taunton, and we come to you every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. So before we get into today's show, I just wanted to share an update. The past couple of weeks, we've been talking about two exciting in-person hiring events that we held here at the hospital on Tuesday, April 5th, and also on Tuesday, March 29th. So we had a hiring event on the 29th for nursing and CNA candidates, and on the 5th for all ancillary departments. And I just want to share a huge thank you and shout out to everyone who attended, everyone who shared information about our hiring events or referred family members or friends. We had a wonderful turnout, lots of people that showed up wanting to come and work for us here at Morton Hospital. And between those two hiring events, we have actually made offers to fill more than 35 open positions. So we are so excited about that, and we look forward to welcoming our new team members over the course of the next couple of weeks. And if you missed our hiring event, but you are still looking for a career opportunity, we still have plenty available in certain positions such as nursing, CNAs, and some ancillary departments. You can always check out our available career opportunities online to find the most up-to-date information on open positions if you go to jobs.steward.org. And then if you search for jobs in Taunton or select Morton Hospital, you can search all of our open positions and you can apply right online. So again, plenty of career opportunities still available if you did not make it to our hiring events, but also a huge thank you to everyone who came and everyone who will be joining our team over the next few weeks. And this week we have a few different celebrations happening here at the hospital, so we want to give a shout out to those teams. It is Telecommunications Week, so that is our switchboard team here at the hospital who is here 24/7, answering our phones, directing our calls. Wonderful team. We want to thank them for all that they do and the great resource that they are for our patients, for our visitors, for anyone calling for information about the hospital or to connect with our different departments and providers. So thank you to our switchboard team. It's also Occupational Health Nurses Week. So here at Morton Hospital, we have an incredible team of two in our employee health department. We have Alexa and Melanie. They are wonderful. They do so much to support our employees in their health and wellness. And we want to give a special shout out to them. They've also played an instrumental role throughout our process of, vaccinating employees and keeping our employee vaccination status and all of their health records up to date so that we can make sure that our employees and our patients are healthy at all times. So thank you to our amazing occupational health nurses here in our employee health department. And lastly, although it's Wednesday, yesterday we celebrated Radiologic and Imaging Nurses Day. So we have three great nursing team members in our imaging department, actually, and they work very closely with our interventional radiology team. So we also want to give a shout out to them and thank them for all that they do for our imaging team and supporting our staff and our patients there. So today we have another one of our surgeons who is joining us with some great information about the general surgery program here at the hospital, as well as our bariatric program, because he does both. So let's jump right into today's show. So our guest for today's show is Dr. Bruce Bodner of our Morton Surgical team over in the Thayer building at Morton Hospital, and we are delighted to have him here today to talk about all things surgery. So welcome, Dr. Bodner.
Thank you, Julie.
So tell us a bit about yourself and your background.
Well, I was born in New Jersey. Please don't hold that against me. But I lived in New Jersey until I went away to college, and then I went to college at Colgate University in New York State, and then after that I went back to New Jersey for medical school in lovely Newark, New Jersey, and 4 years there. And then by the time I finished with medical school, I was sure that I wanted to be a surgeon, and I matched at the surgery program at Mount Sinai in New York City, and I spent 5 years there in training, and then another 8 years after training as a junior attending there.
Okay. So you said you were sure you wanted to be a surgeon. So
Sure.
what was it about surgery?
Well, surgeons have an advantage over other physicians in that we can, to some extent, choose our patients. If a patient comes to us with a problem that we don't think surgery will help, we don't do surgery on them. Medical doctors, they get people coming into their office with all sorts of ailments, and they have to do the best they can. But they can't decline to treat them.
Sure.
But
Yeah. Same with the emergency department. Yeah.
in surgery, the patients generally get better. They don't always get better, but generally they get better.
Okay. Well, that's a good reason. So,
Right.
I mentioned that you're part of our Morton Surgical team. So maybe you can take a couple minutes to talk about who the team is, because everybody sort of has an area of expertise.
Sure, absolutely. The oldest member of our team is Dr. Charles Thayer, and he's been working in Morton as a general surgeon since 1985. His father was a general surgeon at Morton before then. And he does a wide range of general surgery. He does pacemakers, and he's the chief medical officer for the hospital staff now.
Sure is.
We have other members of the team. Myself, I came in 1993, and I do general surgery. I do bariatric surgery. I also do pacemaker surgery. And then I have two other associates, Dr. Demopoulos, who does general surgery, and he has a specialty in colon surgery, and Dr. Patricia Andrade, who does general surgery and has a specialty in breast surgery.
Okay.
So we have a wide range of experience. I was totaling up all the years of experience, and it comes to about 140 years of shared surgical experience. So
That's pretty impressive.
Yeah.
That's, if anyone's questioning, you
amount.
certainly have a lot of expertise. And of course, you have a large office staff over there too in the Thayer building. It's one of our bigger offices.
We do, and
lots
we
of
have a
great
nurse
people.
practitioner, Mr. Hayes, James
Yes.
Hayes. He's very helpful to us in managing our patients on the floor before and after surgery, and as an outpatient sometimes too.
And I know that our all of you as surgeons also do a lot of rounding on our staff to check in
Sure.
on patients and everything else, which is great.
Sure.
So we have actually interviewed Dr. Andrade in the past, and I know I'm also looking forward to interviewing Dr. Demopoulos soon and talking to him about his expertise in colorectal surgery. But I want to talk to you first about, general surgery. But before we do, because I want to give you the opportunity to go into detail so we can be very thorough about talking about my next couple of questions, it is time for us to take our first break of today's show. So if you're just tuning in, we are sitting here with Dr. Bruce Bodner. He is a general surgeon and bariatric surgeon right here at Morton Hospital with our Morton Surgical team over in our Thayer building. We've learned a little bit about Dr. Bodner's background, and when we come back, we want to learn all about what general surgery actually is and the types of procedures that he performs in general surgery. So it is time for our first break, and we will be right back after these short messages.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to Morton in the Morning. Thank you so much for joining us today. If you're just tuning in for the first time, or if you're unsure how to contact us here at our show, I want to give our listeners our email address, and that is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. And you can reach out to us if you want to send us an email to share any feedback about our show or any follow-up questions, or if you want to give us some suggestions about topics that you'd like to hear about in the future. We'd be happy to get some special guests on and take your suggestions and really focus on what you want to hear about on our show. But either way, hopefully you've been enjoying our show week after week and all of the great guests and topics of conversation that we have been having. So if you're just tuning into today's show, today we are here with Dr. Bruce Bodner, who is a general and bariatric surgeon here at Morton Hospital. He practices with our Morton Surgical team over in the Thayer building at the hospital. And we have gotten to know a little bit about Dr. Bodner's background. But right now I want to talk a little bit more about general surgery itself. So what types of surgery does general surgery encompass?
Well, I was thinking about that. Now I would say it is a specialty for a wide variety of soft tissue conditions. Mm-hmm. By that I mean conditions of intestines, abdominal wall, breast, and other associated skin conditions. Mm-hmm. It used to have orthopedics in it, and it used to have gynecology in it. But those two fields have established their own specialty fellowships. So typical cases for general surgery would be removal of the gallbladder, for example.
Okay.
The removal of the gallbladder is probably the most common operation. Removal of the appendix for appendicitis, very common. Many hernia operations, different types of hernias, both internal and external hernias. Intestinal surgery, like surgery for diverticulitis, surgery for tumors of the intestine, breast surgery, skin cancers.
Yeah, I was going to ask about that because we used to, on occasion, do those skin cancer screenings. So I assume that, if you needed something removed, then you're the team that takes care of that. So when it comes to general surgery, we often use the terms laparoscopic or minimally invasive. And what does that actually mean when someone hears that?
Sure. Before around 1992, operations on the abdomen were done with an incision, usually at least 6 inches long, an incision in the abdomen to get access to the gallbladder, the appendix, or the intestines, whatever needed to be done.
Pretty large.
Right. And that was probably a minimum.
Yeah.
Since the early 1990s, there have been inventions in optics and in digital cameras that allowed devices to be made that can be inserted into the abdomen through very small incisions, maybe a half an inch in size. You can put a laparoscope in that has a camera on it and a light, and you can see inside the abdomen. And then you put however other small incisions that you need to do the work inside that used to require a 6-inch incision.
Okay.
obviously there's a lot less trauma to the patient. Healing's better. You have less chance of wound problems with this kind of surgery. Sometimes an incision is still needed, but almost always it's a lot smaller than it would have been without the laparoscope.
Okay. And so recovery time is
quicker.
Shorter.
Sure.
Does it affect, pain also?
Yes.
As minimally invasive, you would think a smaller incision.
Oh, yes.
Some of that pain on the surface area would, of course, be impacted.
Maybe some of the listeners have relatives who have had their gallbladder removed in the old way. It used to be a 6 or 7 inch incision, and people would be in the hospital for a week. Nowadays, it's an outpatient procedure.
Okay.
People don't stay in the hospital for more than a couple of hours unless it's a complicated case for some reason.
Wow, that's amazing. So speaking of the gallbladder, because you said it's one of the most common, what are some reasons that someone would have to have their gallbladder removed? I mean, I know for the appendix, there's appendicitis. What specifically inflicts the gallbladder that would cause it to be taken out?
Stones form in the gallbladder.
Okay.
The fluid that's in the gallbladder comes from the liver. It's called bile, and it has a lot of cholesterol in it. And sometimes that cholesterol precipitates out and forms a stone. And that stone blocks the gallbladder duct, and that causes pain. That's the most common situation. Is someone has pain, especially after they eat a meal, when the gallbladder is trying to contract, but it can't because a stone is blocking it. Sometimes it's worse than that. Sometimes the gallbladder gets infected, and then it becomes a more immediate and dangerous problem.
Okay. So diet can affect your gallbladder.
Yeah.
The cholesterol you mentioned, right?
Yeah, and it seems like it's very common in the United States. About 500,000 people a year have their gallbladder taken out in the United States. It's more common in women than men, but it's common in men too. It's more common in people who are 30, 40, 50 years and older, but we've taken out gallbladders as young as 12 years old at this hospital.
Yeah, okay. Well, I'm fortunate to still have my gallbladder, even though I don't know what purpose it really serves.
Yeah, it doesn't serve much of a purpose. People can have it removed and they don't have any problems afterwards.
Okay.
So if it comes to that, don't fear the loss of the gallbladder.
Okay, excellent. So I want to transition now and talk a little bit about bariatric surgery, because we now also have a full team at our Center for Weight Control. It's yourself, Dr. Pecue, and Dr. Dacio, who is one of our newest surgeons. And now we also have Dr. De Silva, who is our medical director of medical weight loss management, which is really exciting. So what are the specific weight loss options offered here at our Center for Weight Control?
Well, I'll start with the medical options first. Dr. De Silva treats patients for weight loss using a wide variety of medications. There's actually 4 or 5 different types of medications that can be used to help people lose weight, and that can be very effective for some people.
Yeah, and she actually just attended a meeting that I just had today, actually, with some of our practice managers, and was talking also about like meal replacement therapy. I think that's something she's looking into as well. And so what about the other options in terms of surgical?
Well, the operation for weight loss that we do at Morton is called a sleeve gastrectomy. Most of the stomach is removed, and what's left is a tubular stomach that I guess reminded somebody of someone's sleeve in a shirt, because it's a tubular stomach instead of what it originally looks like, which is kind of like a wine sack or something like that.
Okay.
And this operation helps people lose weight in 2 different ways. First of all, of course, there's less room for food because it's just a tubular stomach now instead of a sack. And secondly, the stomach, when it's empty, secretes a hormone called ghrelin, which stimulates the appetite. When you take most of the stomach out, it's not there to produce that hormone, so people are less hungry.
Okay.
So they eat less, and they typically lose, considerable amount of weight.
Okay, great. And that type of surgical procedure, the sleeve, is that the most common form of bariatric surgery?
Yes, it's
Okay.
now the most common type of bariatric surgery across the United States.
Okay.
There are other options. For some patients, a gastric bypass is more appropriate. These are patients who perhaps are severely diabetic, or they have a lot of reflux, esophagitis. They are better served with a bypass operation. And for that, we have the patients go up to St. Elizabeth's Hospital.
Yep. And our team still actually
Sure.
does those procedures as well there. So, who is eligible for weight loss surgery? What are the criteria?
Well, there's a number called the body mass index. It's a combination of somebody's weight balanced by their height, and it gives a measure of their level of overweight. To be eligible for bariatric surgery, patients have to have a BMI of 40. What's a BMI of 40? Well, I think the listeners will have to look that up on their own on the internet. There's several ways of calculating it. But for an example, a woman who's 5'4" would have to weigh about 240 pounds to be eligible for bariatric surgery by a BMI of 40.
Okay.
A man who's 5'9" would have to weigh about 270, 275 pounds. These are just examples. Of course, there are lots of different weights, lots of different heights, and you have to plug it into the formula. Also, if someone has diabetes or high blood pressure or some other serious obesity-related, what we call a comorbidity, some other medical issue that's caused by the obesity, then a BMI of 35 makes them eligible, and that's considerably less.
Okay. And so, in your opinion, if someone has that BMI over 40 or over 35, if they have the comorbidity, when should they seriously consider weight loss surgery?
When they have failed medical management and dietary management, most of the patients that I see are in their late 30s, their 40s, or their 50s, and they've done diets many times. They may lose 10 or 20 pounds with a diet, but then it comes back. And when they have a pattern like that of not being able to lose weight and keep it off, then surgery is an option. We recommend it for people with this BMI because it really has been shown to actually save lives. People who have this kind of surgery live longer than those patients with that weight who don't.
Okay, well that's a good segue because I was going to ask about what the other benefits are to the surgery outside of just the weight loss. So extended life expectancy. What else?
It's very helpful in treating diabetes, especially type 2 adult onset diabetes. Most of those patients are able to get off all medication for their diabetes after successful bariatric surgery. That's, I think, the most significant medical condition that's treated successfully with bariatric surgery. Also has beneficial effects on high blood pressure and degenerative joint disease. We get a lot of patients from the orthopedic surgeons when they say that they really need to have the patient lose weight prior to having orthopedic surgery or as a adjunct to the orthopedic surgery on their knees or their hips.
Okay. Well, it sounds like those are all really great benefits, and I appreciate you talking about, when someone should consider the surgery. But Dr. Bodner, I do have a couple more questions for you that I want to make sure we get to for our listeners, such as, the process towards surgery. I want to make sure we share information about our info session and support group, phone numbers, and everything else, and share a final few minutes with you. But before we do have to take another break because we're almost at the halfway point of today's show. So we will be right back after these short messages. Please stay with us as we return for more with Dr. Bruce Bodner of our Morton Surgical team and our Center for Weight Control here at Morton Hospital.
back with more of Morton in the Morning in just a few moments here at WVBF.
Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to the second half of today's Morton in the Morning show. If you're just tuning in, a reminder about how you can contact us here at Morton in the Morning. You can send us an email anytime at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD. And you can email us if you have any feedback about our shows, if you have any follow-up questions, things that you heard but may have missed a little bit of the information, or just if you have any suggestions for future shows that you would like us to air. We'd be happy to check your emails, and we do check that email regularly, so please feel free to reach out to us at any time. So today we have a great show and a wonderful special guest. We are sitting here with Dr. Bruce Bodner. He is a general surgeon and a bariatric surgeon who practices here at Morton Hospital over in our Thayer building, and he is part of our Morton Surgical team with a nice group over there and some great staff. And we have been talking about, what is general surgery, what bariatric surgery we do here at the hospital. And before we took the break, we were talking about the benefits of bariatric surgery and when someone should consider bariatric surgery. And I do have, just want to make sure we get to some information for our listeners. If we could just talk for a minute about, the process. So if you identify that someone is eligible for weight loss surgery, what steps do they have to take to get to the actual day of surgery? Because I know there's different tests and other things involved as well.
Well, the first couple of visits are educational. We go over all the details of the surgery and the different options. Everybody needs to go to a dietitian. We have them lose some weight before the surgery in preparation for the surgery. We get lab work, and we treat any abnormalities found on the lab work. Everyone goes to see a psychologist. That's something that almost every insurance company demands. We get a test to look at the anatomy of their stomach, an x-ray test. And we have to make sure that they quit smoking. We don't do the surgery on people who are current smokers. They have to quit.
And why is that?
Well, we found that smokers get more complications.
Okay.
If they don't quit, their chance of the staple line breaking down is higher, and that's a serious complication that we want to prevent.
Okay. And then the same with having them lose a little bit of weight before the surgery. Yes. What is the reason behind that?
Well, it's two reasons. One is that it gets them into the habit of a weight loss diet, so that the restrictions that will be imposed by the surgery won't be such a shock to them. That's the first thing. And also, if people just lose 5 to 10% of their weight before the surgery, there's all of a sudden a lot more room in their abdomen to do the surgery, so it's easier to do it safely. So that's why we have people lose weight.
That makes sense. And then the psychiatry piece, I mean, obviously there's some obvious reasons for that, but
we have to make sure that people are clear about why they're going to have the surgery and about the risks and benefits of surgery. There are some people that you find that think that they'll be able to eat whatever they want and magically lose weight after the surgery, and it's really not like that. There are other, psychiatric conditions that make people not suitable candidates, but that's, pretty rare.
Okay.
It's usually just to make sure that they're clear on what the surgery is and the risks and benefits of surgery, that they can give an informed consent. And it's also a good resource for them. After somebody loses a considerable amount of weight, they feel different about themselves. They might feel different with members of their family, and it's nice to have a psychologist available as a resource for the changes that can be both emotional and physical after the surgery.
Okay, yeah, that certainly makes sense. And I know that some people have to do things like sleep studies. So are all these tests, is it really dependent on what their insurance requires or what you as the surgeon recommend for them?
Well, the sleep study, yes, if they have symptoms consistent with sleep apnea, it's best to get that treated before the surgery.
Okay, great. Well, thank you. That was a great overview of, both programs. Yep. And so, just a couple last questions for you. So what would you say is most rewarding about what you do as a surgeon?
Oh, it's rewarding every day. Just about everybody has anxiety related to surgery, any kind of surgery. And after the process is finished, the operation is done, they're getting better, they're usually so happy and so relieved that kind of response is very gratifying to see in patients when they're very, very pleased that everything's come out well and their life is better now because they had successful surgery, whatever it is, gallbladder, hernia, appendix, bariatric surgery.
Great. And is there anything else just in general that you would like the community to know about what we offer here in terms of surgical treatment options?
Well, we have a group of 4 surgeons here, general surgeons, so there's always a surgeon on call for any kind of follow-up that's needed for the patients. It's close by, and you don't have to travel far.
And we have a great team in our day surgery center. I was just actually reading some of the Google reviews that just came in recently, and we always get so many about the whole day surgery department and the surgical experiences, which is wonderful.
That is great because more and more surgery is being done as a outpatient.
Yeah, great.
Shorter stay.
Well, Dr. Bodner, we really appreciate you sharing with us today. And, as a follow-up for the bariatric program, later after we end our time, I'll share some information about the monthly info session and support group that we do for people, and also the phone number to call both the Center for Weight Control office and the Morton Surgical office. So thank you very much for sharing with us today. We appreciate it.
Thank you for giving me the opportunity to talk to the people of Taunton.
Okay.
It's a real pleasure.
Hopefully we'll have you on again soon.
Thanks.
All right, thanks.
Bye-bye.
All right, well, thank you again to Dr. Bodner. We appreciate his time. I certainly learned a lot. Now I know who to go to if I ever need that gallbladder removed. Our expert team here at Morton Surgical, and as Dr. Bodner mentioned, it's over 100 years of combined experience among our team. So certainly a team you can trust when it comes to any general surgical needs or breast surgery, colorectal surgery, or bariatric surgery here at the hospital. So thank you to Dr. Bodner. As I mentioned, I want to make sure that I give out the phone numbers and info on our support group that we do monthly. So let's start with the phone number. So if you have some concerns or are interested in meeting with a surgeon, one of our general surgeons over at Morton Surgical, you can call that team at 508-824-4535. Again, that's 508-824-4535 if you are interested in scheduling a consultation with a member of our general surgery team. They would be happy to speak with you. And then for bariatrics, if you want to contact our Center for Weight Control to learn more about either the medical or surgical weight loss options that we offer through our team, you can call our Center for Weight Control at 508-301-2434. Again, that's 508-301-2434, and that is for our Center for Weight Control, which is Dr. Bodner, Dr. Pecue, and Dr. Desio. That's our bariatric surgery team, and then Dr. De Silva, who is new to the team, who does the medical weight loss management. Also, I should mention, as I have in past shows, that our Center for Weight Control is award-winning. So we have both our Bariatric Center of Excellence designation, and we were also voted by our community in the Metro South region as the best of the best for weight loss in the Metro South region, and that was for the 2021 Best of the Best Community Choice Award. So Best Weight Loss Center for 2021. And then I also wanted to mention, if you're interested in bariatric surgery or medical weight loss, we do host a monthly weight loss surgery info session and support group. So that is actually virtual right now, and that means you can participate from the comfort of your own home or from work or wherever you choose to participate, wherever you're most comfortable. And that is held on the last Wednesday of every month from 3 to 4 p.m. And again, that is virtual, so you will, if you go to register online, we have the link to participate posted there, or if you wanted to call and sign up, a member of our team over in our office can also make sure that you get the link sent to your email so that you are ready to participate. And basically that's a monthly event that it's for anyone who wants to learn more about the weight loss options that we have, or it's also for people who have already had surgery and are looking for support as they maintain their weight loss. And there's different, topics that are discussed every month as far as, dietary guidance and just helpful tips on losing weight and keeping that weight off. So monthly info session and support group, you can find the information on that either on our Facebook page, facebook.com/Morton Hospital MA. You can find it on our website. If you go to mortonhospital.org and click on our events page, you will find the info there. Or if you go right to Eventbrite, that's where the registration page is posted, and you search for Morton Hospital Weight Loss Info Session, you can find that there as well. But best bet, go to our website or go to our Facebook page, because we always have our upcoming events posted on those two locations, and you'll make sure you get to the right registration page and where you can find that link to participate. So thank you again to Dr. Bodner. That does wrap up the interview portion of today's show. But as we usually do, we certainly have some updates that we want to share with you, some general updates and also some information about upcoming events at Morton Hospital. So we will share those during the last segment. So if you're just tuning in, today we interviewed Dr. Bruce Bodner of our Morton Surgical team. And we talked a lot about the general surgery and bariatric surgery treatment options right here at Morton Hospital. He gave a great overview of the different surgical options, as well as the team over at Morton Surgical. And you can always find more information about both the services and the doctors on our website, mortonhospital.org. And if you click on the Doctor Finder link on our website, you can find out more information about all of our surgeons and even request an appointment online if you prefer to do it that way versus calling the office. So it is time for our last break of today's show. So when we return, we'll just share some basic hospital updates and some information about upcoming events. So we hope you will stay with us and listen in. We'll be right back after these short messages.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the final segment of today's Morton in the Morning show. We hope that you were listening into today's show, but if you are just tuning in, we had a great interview with Dr. Bruce Bodner, who is a general surgeon and bariatric surgeon with our Morton Surgical team. That office is over in the Thayer building at Morton Hospital. He specializes in general surgery and bariatric surgery, and he gave a nice overview of both and some of the common procedures that he performs here at Morton Hospital. Who would need general surgery, who should consider weight loss surgery. So it was a great interview. We thank Dr. Bodner for sharing with us. But if you missed the interview and you want to listen to it, we do share all of our shows online. So those are posted via YouTube, but we share them on our Facebook page. So if you're just now tuning in and you wanted to listen to today's show, we will have that show posted later in the week on our Facebook page. If you go to facebook.com/Morton Hospital MA, we will share the link and you can listen to our full interview with Dr. Bodner. Before the break, I did share some information about our monthly weight loss surgery info session and support group that happens virtually on the last Wednesday of every month. So our next one would be Wednesday, April 27th at 3 p.m. That is virtual, so on the registration page, you can find the link to sign on and participate. Or again, you can certainly call our Center for Weight Control office for more information. And anyone is welcome to join that every month. It's free, it's virtual, so you can participate in the comfort from the comfort of your own home. And you can learn more about the weight loss options here and also get support from our team and from others who are going through the same journey as you. So we definitely recommend that people, if you are even considering surgery, or if you're just looking for support in losing weight and keeping that weight off if you've already had the surgery, then certainly join that. Again, it's free, it's virtual, and it happens every month, the last Wednesday of every month from 3 to 4 p.m. So on to some general hospital updates. As you know, we like to keep our listeners up to date on our latest new providers and specialists here at the hospital because we are certainly growing in many different areas and we are always welcoming new providers to our team and to our community. And if you are in need of a primary care provider, we are very excited to welcome another new primary care provider to our team, and his name is George Vardulius, and he actually specializes in family medicine. And he joins our Steward Medical Group Primary Care at Northwoods team. So their office is up at the Northwoods Medical Center, 2005 Bay Street. They are in Suite 201, and that is in Taunton, right up near the BJ's Plaza, with convenient access to 495. So Dr. Vardulius joins our team up there. If you are in need of a primary care provider, want to learn more about him, you can call that office at 508-822-2266. Again, that's 508-822-2266, and that is for our SMG Primary Care at Northwoods practice. So we welcome Dr. Vardulius. We are grateful to have him join our Morton family and the Greater Taunton community. Let's talk about events. So last week, we were very fortunate to participate in two wonderful community events. The first was last Friday. We had a group of 12 of our team members because Morton Hospital was a sponsor of the event. So we purchased a table of 12 with that sponsorship. We went to the Boys and Girls Club's annual Bid for Kids Gala at Gillette Stadium. It's always an incredible event for such a great cause to support the Boys and Girls Club of Metro South. So our team enjoyed that event, some guest speakers, some auctions, and other great festivities. So thank you to the Boys and Girls Club for putting on such a great event on Friday. And we were also very fortunate to be part of the Mayor's Inaugural Ball on Saturday evening up at the Clarion Hotel, which of course many of us know as the former Holiday Inn of Taunton. Another great event, lots of great folks from our community there to celebrate Mayor O'Connell. And again, Morton Hospital was very fortunate to be there with a group of our both leadership and frontline team members at the hospital who wanted to celebrate with our community. So 2 great events, and we also have a few great events coming up in the next couple of months. On April 27th, we look forward to participating in the Taunton Area Chamber of Commerce's annual meeting, which we are a sponsor of, and that meeting this year will be held virtually. So that there's still room to participate as far as I know. If you go to the Chamber of Commerce website or their Facebook page, you can learn more about participating in that event. Here at the hospital, we are a sponsor. We have a few people participating. We're going to do it right from our office and have a little luncheon as we all participate virtually and join our other chamber members in this great annual event. And then also on April 27th, Taunton Area School to Career, which is part of Associates for Human Services, they're doing their annual Business Education Spelling Bee over at Taunton High School. So that is always a fun event that we look forward to being part of. We have done the Spelling Bee for, I would say, the last 3 years now, and what they do is they team up representatives from local businesses and organizations with a student or two, and you all compete against one another for a great cause. The winning team actually gets some great scholarships and prizes for the students that are paired up with that team. We were so excited to have actually won the spelling bee a couple years ago. We hope we can bring home that trophy again this year, but if not, it's still a wonderful event for a great cause. We've been supporting Taunton Area School to Career for many years now. It's just a great group of people, and they're still accepting teams. So if anybody out there wants to participate in the spelling bee, you can go to the Associates for Human Services website and check out their upcoming events. And the person that we reach out to there is Deb Howland. She's the one who manages that event, and it's always a lot of fun, again, for a great cause. So anyone out there, please join us at the annual Business Education Spelling Bee. And then on April 30th, Morton Hospital is a corporate member of the Kiwanis Club, and we are sponsoring their annual Kiwanis Cook-Off. In the past, that event was known as the Men with Taste, but of course they want to be a little bit more inclusive, and it's just an annual community cook-off now. They've changed the name, but it's the same great event. They are going to have, you can go and sample different foods. They have music, entertainment starting at 8 p.m. that evening by Manny and the Goat Ropers, which I believe is a country band. So we actually have our head chef here at the hospital who is contributing a dish. I believe he's making turkey enchiladas, which is always a staff favorite here at the hospital. So he'll be sharing that great recipe and samplings of those enchiladas at the Kiwanis Annual Cook-Off. It's only $20 to participate. So if you reach out to any member of the Kiwanis Club, Dawn Cleary or Carol Doherty, they can get you tickets to that event. Or if you want to reach out to us here at Morton in the Morning, we can certainly put you in touch with the right folks to purchase those tickets. So that's another great event. And then, of course, coming up in May, this is a new event that was just announced by Girls Inc. We will actually be sponsoring that event, and also sending a group of some of our team members to it's called the Women's Workshop. So they have a great day planned there, and I know if you have interest in that, you can reach out to Girls Inc. Check out their Facebook page. They did post the event on Facebook as well. And May is actually full of events. We have Hospital Week, we have Nurses Week, and we also have EMS Week. So that's our chance to recognize and celebrate our EMS partners out in the community for all of the amazing work that they do. Right now, until the end of the week, we are actually accepting application or nominations for our annual EMS Stewards of the Community Award, and that is each hospital in Massachusetts, each steward hospital, we recognize an outstanding member of the local EMS community for an above and beyond interaction, something that they did to save the life or assist a patient or member of the community. So we're really looking forward to that week and the chance to thank our EMS professionals for all that they do for our patients in our community. And if you wanted to nominate someone for the EMS Stewards of the Community Award, you can go to steward.org/EMS Awards. So I know that was a lot, but there is just a lot of great events coming up, and we want to make sure that we share information about those with our community, because we love participating in those events and supporting our local community partners, and we know that a lot of our listeners like to do the same. So we will certainly share any other information in the coming weeks about other great events that are scheduled and that are coming up that are open to the community. So that wraps up today's show. We covered a lot of great information. So again, if you missed anything, the best way to stay up to date on what's happening here at Morton Hospital and to listen to our past shows is to follow our Facebook page, facebook.com/Morton Hospital MA. We post information about, again, we post our shows, we post upcoming events, we post information about our new doctors, we post a lot of pictures about stuff that happens here at the hospital, including staff celebrations and everything else. So if you want to stay up to date on what's happening at your community hospital, follow us on Facebook, facebook.com/Morton Hospital MA. And as I've mentioned before, you can also reach out to us at any time here at the show at Morton in the Morning at steward.org, MORTON in the morning at STEWARD.org. We want to thank you so much for listening today, and also thank Dr. Bodner for joining us and being our special guest today to talk about general and bariatric surgery programs here at the hospital. And we will look forward to joining you again next week with another new show. So from all of us at Morton Hospital, we wish you a happy and healthy week. We will see you soon. Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.